Today we're talking about the toll the COVID-19 pandemic is having on many young Americans. We are talking about teen anxiety. Let's welcome to the discussion Dr. Anisha Abraham. You're a pediatrician, you're a teen health specialist, and also an author. Thanks for being with us.
Thank you.
Certainly, it feels that everyone is feeling some level of anxiety. Can you discuss for us exactly what is the medical definition of anxiety?
Well, we do know that a lot of young people are feeling very uncertain right now. They're feeling very isolated from their peers and their family members who may not be able to go to school or do extracurricular activities. So all of that's increased the level of young people that are actually reporting feeling stressed or also feeling anxious or even feeling depressed. And I certainly think it's important to know that there's a continuum when we talk about anxiety. And so sometimes having a little bit of an increased heart rate or feeling a little nervous about something that's happening can actually be quite good in terms of preparing for a test. But certainly when we talk about clinical anxiety, we talk about if you're having persistent symptoms, it's happening all the time. It's certainly impairing you from doing the things that you want to do, and it's continued for some period of time. That's where, again, it can become a real issue and one that you certainly want to get help from a provider.
I know that a lot of adults have a problem recognizing anxiety in themselves. I imagine teens might have an even harder time doing so. Is it now up to the parents and other adults in their lives to recognize what's going on?
I think you bring up a very good question, which is whose responsibility is it really when you have some of these issues? And I think the bottom line is that it is very important for parents to be aware of the signs in themselves as adults. And we know a lot of adults right now are saying that they're feeling anxious, and the true level of anxiety has really increased in the last couple of months among adults, but also to be aware that young people may have anxiety. They may not always talk about it. It may be a little bit more difficult to tease out which is true adolescent behavior and what is anxiety. So certainly having adults be aware, having conversations and connections, but also informing and educating young people to be aware of what the signs are to be able to get the support they need.
You know, you hit the nail on the head when you said sometimes that can be difficult to tease out of an adolescent. I have two little boys. One's not so little. He just turned 12. My little one is 10 and a half. And my 12-year-old we're just coming into those years of, how are you? Fine. Is anything wrong? No. And I thought, oh no, he used to just never stop talking at the dinner table. And now that window is beginning to close. Is that fairly typical, I assume, with children in their young and middle adolescent years?
Absolutely. I think you're bringing up some classic things that parents tell me, and certainly as a mother myself, I've experienced of having two boys at home. And there certainly can be some changes, and every child is different. So temperamentally, they have different ways of responding to what's going on around them. But we do know during adolescence, as they go probably more into middle adolescence, 12, 13, 14, they tend to want to probably be more with their peer group within themselves, probably not talking to mom and dad as much. Doesn't mean that they don't still want your love and support, but they have very different ways of interacting. And I will also just add that hormones have a lot to do with, again, how young people are thinking and acting, and certainly can also really very much affect how they feel emotionally about what's occurring. So again, classic adolescent behavior, but all the more reason why we really need to be tapping into that and truly knowing what is it that's just developmental, and when there's an issue, when there's something we need to give more support on.
I've heard from so many parents who have children who are a bit older than mine, who are, fully in their high school years, in their later teen years. And they say that the pandemic is much harder on those teenagers who used to be able to, grab the driver's license and the keys and head out with their friends all day. Those 17, 18, 19-year-olds don't want to sit at home all day with mom and dad, which is what our boys are doing. How specifically is the pandemic really impacting children and young adults in that age group?
Well, I think that you brought up a very interesting point, and one that, again, a lot of young people are expressing, and certainly parents are expressing, which is that it's very normal for them to spend time with their peers, to be doing extracurriculars, to be out doing sports, or just hanging out with them, and they're not able to do that. And part of adolescence is also being able to create some autonomy and independence and be away from your parents. So some of that also is being very much affected when you have to stay home or you're not able to go out. And I think that it's important, again, to respect that, to be aware of that, to know that what they're going through can be particularly tough. And I, again, say that research and studies have confirmed young people are feeling more frustrated, more stressed, In fact, on one survey, 61% of young people said they felt more lonely than they've had before, and are identifying, half of them also identified as having some type of mental health struggle. So it's really important to realize that kids are going through this, they're having a tough time, they're not able to do what they usually do, and we need to really be able to support them in terms of it, because they may not always come to us for that help.
And part of what you say is that it's really up to the grown-ups to help the adolescent manage his or her expectations. You know, at the beginning of this pandemic, I think we all joked, well, you know, if I've got nothing else to do but work, you know, I should be 20 pounds thinner, you know, my house should be spotless, right? I should get to all those home projects that we've always been putting off. And I feel like no one's done any of that. As an adult, I get that we're managing through a crisis, but I think might some of these teens be thinking, I should be doing more, I could be doing more. Talk to me about how expectations can, you know, can really make us miserable if they're not realistic.
Well, I think that I tell parents a lot that we need to reduce our expectations on ourselves as we're going through this pandemic time. And certainly by extension, we need to also reduce our expectations on our teens, and also get them to realize that they don't need to hold themselves so high in terms of their expectations to themselves. So as parents, many times we think we need to be able to do all of our work completely. On top of that, we need to balance what's happening at home and have perfect meals, and our house needs to be spotless. And of course, many of our kids are at home right now, so we're trying to juggle all of that and get time for exercise. And I'm just going to say it's hard to do it all. I think we all struggle with making sure that we can get all of this done. So to reduce those expectations, to know it's okay not to have perfect meals, it's okay not to have a perfect house, that there are going to be those moments where you're going to have some conflict and it's going to feel tough at home, is one piece of that. But certainly imparting that to your own teenager. And again, lots of teens can be really tough on themselves. They're still expecting themselves to do really well. They're still expecting themselves to be in top shape and do, you know, other things in the future. And it can be really hard. And one of the concepts that I think is important is the concept of unevenness, which is that we all, adults and young people, excel in some areas and we don't excel in others. And knowing that, and then also building up what we are good at, what our strengths are, is very valuable. And I'll just give you one example. I have a son who loves technology. And so he's really used this time to create his own YouTube channel and do all these do-it-yourself projects. And that's been very positive for him. And he's the son that also loves being online, whereas my other son can't do online at all. It's really been very tough for him. So realizing that some people are going to do better in some situations than others, and then really working on what those strengths are, is so important.
Right. There's also another word that's you know, sort of in the conversation daily, it seems, and that word is resilience. I feel like 10 years ago, parents put everything they had into making sure their little one didn't run into obstacles, right? It was that helicopter parent or that lawnmower parent. Let me get that meeting with the dean for you. Let me talk to your teacher about why you didn't get an A on that paper. More and more, I think parents are realizing that it's the child's lesson to learn, as hard as that may be to watch. But after the child has failed, let's say, and look, my little one, he has missed, I don't know how many assignments, right? He, you know, we're getting calls from his teacher, and we're saying, this is, you know, I already went to 5th grade. This is for you to deal with. How do you help a child learn resiliency? Because sometimes they don't care that they're missing assignments, or they can get so down that they're missing assignments. They'll think, I'm a terrible student. I'll never catch up. I shouldn't even be in 5th grade. You know, it can be a very quick spiral.
I have to say that one of probably the wonderful things that's come out of the pandemic, if there's such a thing as wonderful, is it does give parents the opportunity to teach kids about resilience. And probably the biggest predictor of success as an adult is not having a perfect CV, or, you know, being in every extracurricular activity and being, you know, an A student, but it's being able to handle life's failures and to get back up on your feet. And I call it the concept of having bounce. And what we do know, and I think that we can certainly really encourage our kids to think about, is the ways that we handle this right now is going to prepare us for all the other challenges that are out there in the future. And so coming back to your very specific concern about how do we help a child that's struggling, for my son that's having a difficult time with the online experience, one of the things we did find out is that he loves dogs. And so we've now created dog walking opportunities. He has a dog walk job in the middle of his day, and that is actually his highlight right now. So it's coming back to what makes him happy, where his passion is, and knowing that those are the things that are going to help kids to get through through these experiences. And we talk about the fact that, yes, things are tough. You're not with your classmates. This is hard because you don't like this experience, but we're going to get through this. And all these little things that you do right now are going to make you stronger, and it's going to help you for what's ahead in life.
You've given us so much to follow just sort of for the everyday. Is there something that you can say to parents who are truly worried about their child not thriving, their child sort of shutting down? What are the warning signs we need to be looking for?
I think it's very important for parents to know what the warning signs are. And again, it can be complicated when you have a teenager that is home and is a little prickly and a little tough and is in their room all the time, is on those screens all the time. It's hard to know what's happening. And I think the most important thing is to realize if there's a change from what's been happening currently. So if they had been, for example, connecting with their friends on computers or phones or social media, and they suddenly have a huge change with that and they're withdrawing from family members. There's a difference in terms of their sleep or eating habits. They're really irritable. And probably the more important thing is talking to kids specifically if you have any concerns at all. Many times as parents, we don't want to ask because we're afraid, particularly when we talk about suicide. We're afraid if we ask these questions, they're more likely to get depressed or suicidal. And in fact, we know the converse is true. By asking, do you feel down? Do you feel sad? Do you feel suicidal? You're more likely to get a young person to open up and to talk about these issues, and to also take away the stigma and to set the, plant the seeds for having these conversations.
And finally, for anyone who is interested in learning more about this topic and wants to know more about your work or the subject in general, are there any good online resources that you can point our viewers to?
Well, I can certainly say that my upcoming book, Raising Global Teens, does talk a lot about some of the tips that I've just mentioned. I think that there are a lot of other wonderful resources in terms of helping young people. For example, the Society of Adolescent Medicine has some great resources for parents and teens, as does the American Academy of Pediatrics. Parents also talk a lot about media and screen use and how to balance that. And Common Sense Media is another wonderful go-to resource in terms of, again, thinking about balance and really helping young people.
There's a lot to think about for sure. Dr. Anisha Abraham, pediatrician, teen health specialist, and author. Congratulations on your upcoming book. I think I see it on the shelf behind you. Is that a preview?
Yes.
Okay, good luck to you. Thank you so much. You've given me a lot to think about with my two little boys, and I'm sure many others would agree. Thank you for joining us.
Thank you.